Hi everyone, thank you for joining our virtual dental shadower session. We want to remind you that in order to get your hours, you will have to take a short quiz, and as long as you get a 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, so let's get started. We are very fortunate to have Dr. Richard Liu for today's session. I'm handing the mic over to you. Feel free to start whenever you want.
Hi, good evening, everyone. My name is Dr. Richard. I'm currently a first-year pediatric dental resident, and this is sort of like a little presentation giving you guys a little like 101 to a pediatric dental residency. So kind of getting started with some background info. For my undergraduate, I went to University of Pacific in Stockton, California for my Bachelor of Science in Biological Sciences, and I was part of something called an Accelerated Dental Program. So this was something I applied from high school. And then so with this program, I did 3 years of undergrad at University of the Pacific. And as long as I maintained a certain GPA and a DAT score, this allowed me to get a guaranteed interview, but not acceptance, a guaranteed interview at University of Pacific School of Dentistry. And then so from that, then I moved on to dental school, did 3 years at University of Pacific, Arthur Degoni School of Dentistry in San Francisco. It's one of the few and rare programs that is a 3-year program versus the typical 4-year program for other dental schools. And then currently I'm a first-year pediatric dental resident at Children's Wisconsin in Milwaukee, Wisconsin. And then I am set to graduate in 2023. And just for some general study tips and advice for staying motivated, I like to keep things pretty simple and nothing like groundbreaking really, but it's what was proven for me to work. First thing I'll say is creating realistic and achievable goals. One thing that I like doing is, not creating like a very big goal that seems so intimidating that you don't even really want to start. Set these very achievable landmarks for yourself, and that will encourage you to, be more inclined to pursue that. Another thing is to find an activity to help you de-stress. I mean, it's good to work really hard and all, but we're not robots. And if you keep on working hard without any sort of break and de-stressing, you will definitely burn yourself out. And in terms of the long run, that will not benefit you in terms of success in any way. So find things like, working out, hanging out with friends, or things like that to help you really de-stress. And then in terms of another tip is celebrating your victories, no matter how small. You really have to, reward yourself if you, made some sort of progress to kind of show yourself, that work has been paying off. And equally as important is learning from setbacks, as you probably can know from now, is like the road to dental school or even to a residency is not smooth. There are so many setbacks and failures. And personally for me, failures are where I learn the most. So instead of just, treating each failure as a very sad moment, after, you learned and accepted it, try looking back and really reflecting and kind of asking yourself why it happened. So that way in the future, that does not repeat itself. And also I like to say is being organized and taking breaks in terms of organization, that is finding a system that works for you, whether it be, like Google calendars or having your own little planner. And then last thing is pushing yourself within reason. And the analogy I like using, since I really like to weightlift, is I guess a concept called progressive overload in weightlifting. And it kind of goes back to the story of this man in Greece. He was a boy at first, and he would lift his calf over his head every single day. And do that every single day. And as the boy grew, the calf also grew. And eventually the boy became a man and the calf became a cow. And eventually both become very, very big and very strong. But of course, this didn't happen overnight. Each day, the boy increased his resistance and his strength. And if you kind of go back to in terms of if you want to compare like dental school or even undergrad, you want to push yourself little by little each day, but of course not overwhelm yourself. Like maybe if you can only study with a lot of focus for an hour, maybe try studying for like an hour and 15 minutes the next time, versus giving yourself a goal of studying with no distractions for like 3 hours. That would be way too intimidating and not really realistic. And then just to kind of define pediatric dentistry, this was from the ADA website in which they define all the various specialties in dentistry. And just kind of reading it word for word, pediatric dentistry is an age-defined specialty that provides both primary and comprehensive preventative and therapeutic oral health care for infants and children through adolescence, including those with special healthcare needs. And I think I really want to focus on special healthcare needs because one thing that really separates, pediatric dentists from other dentists is their ability to really work with kids with special healthcare needs, whether it be, very complicated medical histories or having conditions like Down syndrome or autism. And then personally for me, a lot of people ask me like, why pediatrics? It all started off with my pediatric dentist growing up. My mom still tells me that when I was 5, I told her, when I grow up, I want to be just like Dr. Monlaris when I grew up, and Dr. Monlaris was my pediatric dentist. And so this love for dentistry stuck on. And when I was a freshman in high school, I decided to, shadow my pediatric dentist, Dr. Monlaris, the one who inspired me at his office to kind of see if maybe this career is really feasible for myself. And then so from freshman year of high school to senior high school, every single summer, I'll spend a couple hours each day just kind of absorbing it all in. And from that, I really grew to appreciate, not only dentistry, but pediatric dentistry. And other experiences such as being, I was a kindergarten teacher at a Chinese language school. So I taught like these little 5-year-olds how to read and write in Mandarin. And that really, affirmed, my love for working with children and helping them out. And then other experiences like community outreach activities involving children, really proved to myself as, something that will stick. And then further experiences like advanced pediatric clinic. This is something that was offered in my dental school for those who wanted additional pediatric clinical experience. You're allowed to have these various sessions where you worked with kids who are maybe not so well behaved or working with more advanced technical procedures like phlebotomies or crowns and maybe back-to-back fills and things of that nature. So you got a little more advanced clinical experience in peds. And in addition for me, pediatrics, I personally don't really like spreading myself thin. I'm by all means not, spreading shade to those general dentists out there. Personally, for me, I really don't like, not really being good at one thing. So for me personally, I really like being good at one thing and specializing in one aspect versus being okay in, multiple aspects like perio, endo, and peds like that. So personally for me, I just like the aspect of, being a master in one skill. And also the patient interaction is really fun with peds. Kids are so, honest and so fun to work with. And then also the really fast-paced work environment and fulfillment of the career. And also my various mentors and role models have been instrumental in me pursuing this path. So a little debrief of a pediatric dental residency. They're typically 2 years. Some programs are 3 years, I believe, like UCSF and University of North Carolina, they offer a 3-year program, but typically it's 2 years. And I listed some of the bullet points from the AAPD website of the training you receive, so you can read that on yourself, but definitely through your various rotations and just treating patients, you'll get plenty of experience in all those aspects. And then for a typical day of a residency, this would just, I copy and pasted one of my days as a first year. This is by all means not, typical for all the residencies out there, but I just wanted to give you guys kind of a general overview of what my day looks like. So from 7:30 to 8:30, I have lecture. So this can range from topics such as, infectious diseases, space maintenance, orthodontics, and this goes on. So one of our attendings will lecture us from 7:30 to 8:30 a.m. And then I see my first patient from 8:30 to 9:30, second patient from that time, and you can see the list goes down for my various patients. So typically, I can see anywhere from 6 patients to maybe even up to 10 of my own patients a day. And then I'll end the day with finishing up my notes, doing chart review, calling, my patients and maybe their providers, asking them information about, if they need pre-meds or how their health conditions may affect their dental care. And in addition to all this, we have hygiene checks. We have a hygiene column where a hygienist will see really well-behaved patients, and then they'll want us to double check and look for caries, maybe look at x-rays and see if there's any pathologies on panels or things like that. And so that it adds to additional patients that you'll see. So it's a very, very busy day, but you learn so much. And for our program at Children's Wisconsin, we're on call, I'll say, for around 7 days a month. So you definitely get a lot of experience collaborating with our medical peers, like the ER docs, ENT, and learning how to deal with various traumas like avulsions, subluxes, and things of that nature. And of course, we'll have various rotations, like in anesthesiology, cleft palate, and then also OR days. OR days is when we go to the operating room and treat children who need a full mouth reconstruction while they're under general anesthesia, so while they're completely sleeping. And then now I'd like to shift the focus more onto pediatric residency applications and how to be a strong applicant and be prepared. So the first question that usually pops up in people's minds, which program should I apply to? So I provide the link right here to the APD website, and they list all the residency programs in the United States. And it's definitely very, very intimidating at first because there's so many programs, you don't even know where to start. So just kind of help you narrow down that list, I wrote down some of the key things that I looked for and found that was helpful for me to narrow it down. It was location. For location, I personally grew up and was raised in California, and I kind of wanted to stay in California, but then my mentors and other friends told me to, really try looking at other programs. And I'm really glad they told me that, because there's so many other good programs located everywhere and spread all across the country. So my tip is, if possible, don't, limit yourself to a location just because it's convenient, but really open, your focus to other programs as well. Stipend tuition is another factor. A lot of times for dental school, you pay to go there, but for residencies, some programs pay you via stipend, while others you pay them money via tuition. So typically the stipend paying programs are obviously more competitive because they're paying you to, learn there. Reputation is important. A lot of programs are historically, strong in certain aspects, whether it be research, clinical experience, and some programs are just amazing all around. That's a huge factor. Residency types. So there's, I would say, 3 types of pediatric dental residencies. There's hospital-based, university-based, and hybrid. Hospital is typically more experienced. You get work with a lot of patients. The patient volume is very high, so you learn from doing. University, typically the focus is a little bit more on the academic side, more didactically strong, and a hybrid is a combination of both. For special interest, that might apply to some people if you maybe want to pursue a master's degree or get an MPH, or if you want additional experiences, doing special needs or sedation. Some programs might have a stronger, have strengths in those areas that might, influence your decision. So for how many programs to apply to, this is kind of a hard question to answer, but just to give you a general number, I'll say around 10 to 20. And again, this depends on if it's virtual versus in person. Personally, for me, I felt that when it was all virtual, that's when I applied during, the height of COVID. It benefited to definitely apply to more programs, just because since you could interview from your laptop, from your own comfort of your own house, you could, even interview at like 2 places in one day, versus if it was in person, that would be, literally impossible to, go in Texas, interview one day, and then, fly over to Washington and interview there. So I definitely feel like when it was virtual, it gave you the freedom of applying and interviewing in more places, because in person you have to travel there and pay for a hotel, and then there's also social the day before, so it makes it a little more complicated. And additional tip I would like to give out is to do externships, whether it is in person or virtual. That definitely will help you get a feel for the program. This is just a screenshot of the DIA Pass. I'll go more in detail in the specifics of it. So this is general information, like personal information, pretty self-explanatory. Just fill it out to the best of your ability. And then in terms of additional things for like supplemental information, specifically experiences, you can include information like employment, extracurricular activities, healthcare experiences, research, teaching experiences, dental experiences, whether it's paid or unpaid. And then for the achievements section, you can talk about awards like scholarships, honors, presentations you do, or publications. And for additional information, you can even include things like foreign language skills and things of that nature. And then under documents, that's where you put your CV, your resume, your unofficial undergraduate transcripts, and uploading. And in regards to the transcripts, you want to make sure that you upload transcripts for everywhere where you took coursework. So whether it be the community college or other colleges you maybe took classes in the summer for. And then for program materials, it's really important to keep in mind that not all schools have supplemental questions. Some do, some don't. Some have supplemental fees. So you really want to be super organized and make sure you track down everything, because if your application's incomplete, you'll really never get an interview from there. So it's really, really critical that you're very organized and keep track of all the dates and fees and questions and essays. And this was a little interesting. This was something that was new when I applied. It's the COVID-19 impact, and you pretty much explained how COVID affected your application and your dental education. And there's also another useful thing under the DIA Pass. If you go under one of the tabs, which I have in red, check status, it helps you determine if the DIA Pass has received your official transcripts for the schools, your national board scores, as well as your letters of rec. And just for some numbers, this is the cost to apply. For the match service, it costs $95. Match is separate from the DIA Pass. I can go more in detail about how it works and everything. First application to a program applied to is $190, and each additional application is $85. And then for the supplemental application fees, it ranges from $50 to $100. Then, once again, not every single program has it, so you have to be really careful and see which one does. And I'll say roughly a third to half of the programs have those supplemental application fees. And also your DAT national board scores, it's $40 per score report, and not every school requires this too. And then for deadlines too, make sure you're really organized. Maybe have some sort of Google Sheets or Excel sheet up to track that, as different programs have different deadlines. I'll say the earliest are usually the NYU Langone programs, and the deadline when I applied was August 15th. And this is just kind of a little checklist you can take a screenshot of or write down. This is why I had things I want to finish in order to make sure my application's in. With applications, early bird gets the worm. And the little tip I like to give is that you want to make it super easy for your letters of rec writers, as easy as possible, because they're doing a huge favor. So I like getting a very nice manila envelope, and including in your personal statement, like your updated CV, your transcript, and all the information, because your letter writer might only know you in maybe the capacity of dental school or in other forms like that. So if you include other information, it just really helps them write a more colorful personal statement, and gets so as a result, the people reading the letter will get a broader and more in-depth idea of who you are as a person. And this is just my timeline. By all means, you don't have to follow this. It's just what I did to kind of give you an idea of the dates. May 14th, 2020 is when the DIA Pass opened. July 26th is when I submitted my applications. October 21st was my first interview at a residency. December 19th was my last residency interview. And then I'll never forget this day. It was probably the most stressful experience in my life and the most gratifying. January 19th, 2021 was when phase two is when Peds releases it. I believe ortho is phase 1, but for phase 2, that's when the match results came out. And that means that's when if you matched to residency and where you matched your residency. And I would say that for me, submitting on July 26th was definitely a little bit later than I would feel comfortable with, but I had no choice because I was waiting for my quarterly grades to come out. And with COVID, that delayed the quarter grades from, being finished later. So I had no choice. And that was the only limiting factor. I already finished everything much earlier. So I'll recommend for you guys, if you have the, luxury to really submit around late June to early July just to be safe. And then again, different residencies have different deadlines, but I would say by all means don't use that as a means for when to submit them, because I would say pedo programs, even though it's not written on paper, it is rolling. So the earlier you get it in, the faster the program directors will start looking at applications, and they'll start, giving out the interviews in the order in which they receive them a lot of times. So early bird gets the worm. And then I'd like to talk about some interview tips. This works for both, in person or virtual. First 3 bullet points, I'll say it's very, self-explanatory. It seems very simple, but a lot of people fail to do that. Being prepared, do your research, be on time, never be late. Being immersed, a lot of people, are on their phone, or they just really don't look like they're interested, and people can definitely tell, and that's a huge red flag for a lot of these programs. Personally, for me, what I did was formulating talking points. So I had like these little stories or things about myself that I could talk to and, draw from, whether it be kind of answering any question. Of course, within reason, you want to, answer a question completely off topic. Like if they're asking you about your strengths and weaknesses, you're talking about, your passion, fishing or something. So you definitely want to keep it on topic, but having these talking points to help you in those moments where you're trying to struggle to find an answer. Being prepared for oddball questions. A lot of times for pedo, what's kind of funny is they will ask you questions and, make you sing or make you dance. And so you really have to learn how to adapt to these really weird situations and just being prepared. A lot of times they're really looking for your answer exactly, but they just want to see how you respond to these very difficult questions. And of course, there's the common questions like tell me about yourself, strengths and weaknesses, and why pediatric dentistry. So definitely, have your answers prepared. Definitely not rehearsed, but know those, like I said, those talking points. And finally, do your research and write a thank you card or email. And just, because the residency did you a favor, they picked you out of all the other candidates. So just simple thank you is, definitely helpful. In addition, for in-person, I would say eye contact, keeping your phone off, and then being conscious of your behavior even during socials. So for pediatric dentistry interviews, typically there's a social the night before, then the formal interview the next day. And even though the socials are very casual and very laid back, everyone's still watching you. So definitely be professional and be conscious of what you're saying in your language. For virtual interviews, I would say having good lighting. I bought like a ring light from Amazon. I felt like that was pretty helpful because my room was pretty dark. A lot of times if, people can barely see you, they might not be able to, make the best impression of you. And also making sure that, all these forms of distraction like roommates, family, pets, know when you're interviewing. So keeping them away. And then having a clean and professional background, like maybe have a bed in the background, make sure it's, it's nice and clean. And then also what's interesting is with the webcam, a lot of times you have to try looking in your webcam, like treat the webcam like it's a virtual eye for the eye contact. Because a lot of times if you're looking at the screen, even though it looks like you're looking at the interview right in the eye, on screen it might look like you're being distracted and looking at the ground or something. So kind of be conscious of where your eyes are actually looking in terms of the your webcam. And lastly, I'll say wear pants. Like sometimes that's to sing and dance. So definitely it won't end well if you get up and you're not wearing pants. So wear pants. And then finally, I like to talk about the match program. It's what the medical students use to get into their programs. And it's something that we use also in dental school as well. So this is completely separate from Idea Pass. And it's really complicated kind of explaining how it works. I really like this one YouTube video to search up match. And this is an excellent video that kind of explains it to you, but just kind of give you an overview of it. And for match, you rank programs from 1 to however many programs you interviewed at. Let's say you interviewed at 5 programs, for my example. So you'll rank the programs from 1 to 5. But the thing is, you don't have to rank every single program you interviewed at. So let's say if there's this one program of the 5 you interviewed at that you really didn't like, so you don't have to rank them. So then you can rank it from 1 to 4 and leave out that program, because if you put in the program in your ranking list, there is a possibility that you might end up there. So definitely don't rank programs that you don't like. And then what happens in addition to you as candidates ranking the programs will rank all the people they interviewed. And then so if there's a mutual ranking, then you match, and then that's where you end up for your residency. And just for some like statistics, I looked at like these old stats from the Match website. You definitely have a higher percentage of being matched by having more interviews. And that just, the benefit of interviewing at more programs, you increase that possibility, because you only get in one residency program versus in dental school, let's say you can get into multiple dental schools and you can pick, but for match, there's only one place you end up if you do end up somewhere. So that's pretty much how it works. And then that pretty much concludes my presentation. So the floor is open to any questions.
So we do have a couple of questions. And for the first question, we have, what steps did you take to ensure that you were a good applicant for residency?
Can you repeat that question again? Sorry.
Yeah. What steps did you take to ensure that you were a good applicant for residency?
A good question. So for me, entering into dental school, I knew I really want to get into or specialize in peds. So one thing that I did personally was I joined like these interest groups and clubs that relate to peds. So I was part of like the Pediatric Study Club, and this is a club where upperclassmen will give presentations on tips on getting to a residency, and even like these little lit reviews talking about articles from like the AAPD. And another thing is doing well in your pediatric dentistry courses, and of course doing well in your classes, because the first thing I'll say that programs look at is your GPA and your ranking. Is like the first filter. And then I'll say like GPA as a general rule gets your foot in the door. And then after that, they'll look at like, your letters of rec and what activities you're involved with. And that's what, will make them decide whether or not they'll invite you for an interview. So yeah, good question.
And for the second question, can you give us some advice on interviewing for dental school? What are some things that interviewers are looking for?
So in terms of for interview tips for dental school, I necessarily wouldn't say it was different for like residency. Just kind of the main tips is, really doing your research on the programs. So that way the people interviewing know that, you really want to go there because you've done your research and it's been on your mind for a long time. And then the basic stuff like, dressing professionally, talking to everyone that you see, being friendly to everyone. And then I would say just being prepared with like talking points. So knowing whatever question they throw at you, you have like these ideas in the back of your mind. You can, relay it back really fast and, have very strong and very thorough answers.
For the next question, what was your toughest case in residency so far?
Toughest case in residency. So I've only been, I'd say like a month into residency. So this will definitely change as I see more patients and get more experience. But I would say for me, it was probably one of my oral sedation cases where I gave this patient oral Versed. They didn't really sedate that well, so they were moving around. And so to really learn how to, remain calm in those very tough situations where, the kid's crying and screaming. And then so remaining calm myself, and then also, being focused on, the job to be done and really stabilizing the kid, make sure that I'm safe, my assistant's safe, and the kid's safe. So kind of learning how to, work around that. It's been probably the most challenging case I've faced so far, yeah.
And how is treating children different from treating adults?
Good question. I would definitely say in terms of like how you go about it, of course, for kids, they're generally, it's like a new environment to them. So you have to do something that we call tell, show, do. So you go up to the kid, you're very honest about them, but you can't be completely honest. You kind of lie in a certain sense, like you give things like euphemisms, like so instead of you calling like a drill or something, you would say it's Mr. Whistle. And then if you were to give them the local anesthesia or the shot, you never, of course, never say the shot or else they immediately start crying. You call it like sleepy juice or something like that. So you kind of use the terminology used, so use euphemisms to make it sound more kid friendly. That's what makes it different. But in terms of communication, you're still, very open. Just kind of transparent, like with adults. So you're not necessarily like treating them like they're like a different like species or something like that. But of course, you have to be very patient with them because with adults, a lot of times they kind of already know the drill. They'll lay down, have their mouth open. For kids, they really don't know, what to do or even how to sit down in the dental chair. So they guide them everything. And like kind of going back to what I was talking about, toe should do, so you toe whatever you're gonna do. Then you show them like on their hand or something like the sealants and this is the etch and then everything like that. And then finally doing is when you actually do on them. So definitely have to be way more patient with kids, but I wouldn't say it's like drastically different than treating adults.
Okay. Is there a specific class or lecture topic in dental school that you think was the most beneficial to being a pediatric dentist?
Well, I mean, in our class, we had a specific course for pediatric dentistry, so that was very helpful. So, I mean, for that course, I would say at UOP was very strong. So it gave you a very comprehensive understanding to learning about, the growth and development of both kids and their teeth, about space maintenance and the various, ways to deal with traumas and endo, like root canal therapies like that. So I feel like that was really helpful. But I feel like different, dental schools might have different, I guess, strengths in their pedo program. So I'll say just like, usually all dental schools will have some sort of like pedo course. So I'll say that's been pretty helpful for, being prepared for residency.
Can you share a fun patient experience in residency?
Fun patient experience. Let's see. I mean, there's been like a couple. I'll say kids are like super cute and let me think. Oh, what's funny is actually, let's see. So yesterday I was treating a girl who wouldn't open up, and as soon as I said I wanted to give her a shot, she started. I didn't say you want to give her a shot. I said I can get your tooth numb, and then she started crying and everything. And then so from previous conversations, I found out that she had liked watching like an anime and things like that. So we started talking about it, and then anime she's watching was Naruto. So I told her, oh, you can't be, the Hokage if you don't open up. And immediately she like opened up, stopped crying, and wanted to be just like Naruto and everything. So that was pretty cute. So that was a nice little experience.
Wow, that sounds great. So my next question is, did you ever second guess choosing this specialty?
Personally, for me, no, just because it's been something that I've kind of experienced through shadowing. So from shadowing, I could really see firsthand, the workflow and how it is like being a pediatric dentist. And then also my experience from, working with kids that really proved to me that, it's something that I enjoy. So I would say having copious experience shadowing and working with kids is really important, making sure that, this is maybe the path that you want to walk down.
And for our next question is, how do you deal with stress or manage work-life balance during dental school and during residency?
Yeah, I feel like that's a very good question. And a lot of people, have different ways of, going about that. Personally, for me, it won't work for everyone. I'm like super into lifting, and I just feel like just exercising and having that, national dopamine rush when you're lifting and everything like that, and those chemicals going off, it helps you relieve stress naturally and chemically. But some of my friends, they would enjoy maybe like running or maybe hang out with friends, going to bars, things like that. So I just feel like just doing something that you enjoy, like a hobby, is really beneficial. Just getting your mind off of dental school and not constantly thinking about like dental school or residency.
What is something you struggled with in dental school?
Let's see. Yeah, that's for me, I was probably struggling with hand skills and just failing in general. And undergrad, I was really used to, being top of my class and just doing really well. But then in dental school, there's this whole thing with, perfecting your hand skills and practicing your preps. And I definitely was not gifted with those golden hands. So I really had to work hard. And then for me, the most frustrating thing was, even though I'll practice hours and hours, I would still fail the practicals. So it just came to the point where I felt like, what's the use of, trying if I'm just going to fail in the end? But for me, I just learned that my learning curve was much higher than, some of my peers. So through, many hours of, failure and trial and everything like that, I eventually, got the hang of it. So I feel like my greatest challenge was just learning how to deal with, learning how to fail and learning from mistakes.
Is there something you wish you'd done differently in dental school?
Interesting question. I wouldn't necessarily say, I don't think it's dental school related. So I feel like I made pretty good use of my dental school experience. It's probably more of just, exploring SF, because I went to dental school in SF. It's probably having more fun, on exploring the city. So I feel like at some points I, worked to the point where it was a little bit unhealthy. So again, just, finding time to de-stress. So that's probably one thing that I would have done differently, enjoying my experience a little bit more, outside of school.
And the next question is, how do you cope with patient or their family's expectations?
I feel like with pediatric dentistry, a lot of it in terms of communication is with parents as well. And of course, that is being extremely clear with what's going to happen. So I feel like most of the complaints from parents is when maybe you're very, you maybe rush over the details, what's going to go on. Maybe they're expecting their kid to have this crown on, but then they come out and they have no front teeth, and they react and they start yelling at you and asking, oh, what happened to my kid's tooth? So it's really I feel like preventing that from happening is just being very clear and transparent and very thorough with your instructions to the parents and explaining everything to them. So I'll say that's like the main thing with dealing with patient communication and their parents.
If you were reapplying this cycle, anything you would do differently?
I guess it's still different too, because factoring COVID and all, is I applied to, I would say 26 programs, and that's definitely a lot of programs. And I feel like if it were now, because I feel like some programs will have in-person interviews, I probably wouldn't have made it to all the programs I interviewed at. So I might have been, I guess, a little bit maybe more selective on the schools I applied to. But other than that, I don't think I would have changed anything much. Yeah.
How did you improve your hand skills?
Yeah, so for me, like I said, is I was like very systematic about it. So I'll, do everything in a certain, like a sequence and the same steps. So that way, let's say if I'm working on like my crown preps, if I'll like do my maybe occlusal reduction first and do my axial reduction, break the interproximal contacts. So I always have it very consistent. And if I realize that my end product is not passing, then I'll try maybe change one thing at a time. So I was like very scientific about it. So versus, changing like maybe let's use a different burr, let's use maybe a different speed, or maybe use water this time or something. If I change too many factors, I don't know, what created it to work. So I'll like change it little by little and really learn from those mistakes. And other than that, like there's really no magic advice other than just practicing. I know it's probably not what you want to hear, but just putting in that effort and putting those hours is ultimately what's going to improve. But of course, you have to be smart about it. You can't just, keep on working. You have to really learn, what works for you and what doesn't.
The next question is, what more important, grades or hand skills?
For that question, I'm not really sure what you mean by like important for like a pediatric residency. Is that what you're talking about? Like what do the residents care more about?
Yeah, I think that's what the question is.
So I guess like technically residencies, like unless they ask you to like prep on a typodon or something, they can't really know how good your hand skills are. But they can definitely know how good your grades are from the transcripts like that. But I guess maybe your hand skills might be reflected upon your letters of rec or maybe like how well you do in your classes in SimLab. But I would say they definitely look at you like globally. It's not like one is more important than other. They definitely want someone that's well balanced. As because pediatrics, it's a combination of using your hand skills and prepping those teeth, as well as knowing scientifically, medically what's going on with children and how to deal with different situations. So I'll say just being an overall like I wouldn't say one is more important than the other.
Okay. And what's your favorite procedure to do?
I feel like for me, I'm still, in my first year residency in the first couple months in residency, I haven't really done everything. But as of right now, I've been really liking doing crowns. I think it's, I feel like it's something that would really benefit the kids, really good for their teeth, and I feel like it's very satisfying, getting a very good fit on that crown. So for me, I'd just be doing crowns.
And the next question is, what is your favorite tooth?
My favorite tooth. Very good question. I would probably say it's the canine. So I feel like the canine is, what sets, the arch width, and it's like this very strong tooth. It's almost like an anchor. So even though it might not be like flashy, like the central incisors and laterals, it doesn't get all the credit, but I feel like it's really important making sure all the other teeth are in harmony.
Okay, so I think that is it for the questions. Thank you, Dr. Richard Liu, for taking the time to talk to us about your profession. It is truly appreciated, and I know I learned a lot from your presentation. And to our viewers, the quiz is not yet up, but it will be up shortly, and then it will be linked in our link tree and in the description of this video. And once the quiz is up, it will remain open for 24 hours, after which it will close, and scores will be sent out. Just a reminder, a 3 out of 5 is required to receive credit for our session. To Dr. Richard Liu, I want to thank you again for today. Everyone have a great rest of the day.
Awesome. Thank you.